your artwork in.
There you go.
I totally get it. I mean, I have mine over here on the side, but it's kind of it's got like a big light glare right now on it. So
yeah, I had to close the blind. Like it's a whole thing. I get it.
cool. So on behalf of Student Doctor Network, I want to welcome everybody who's joining in through this recorded interview with Dr. Avi Patel, or Avinash, if you want to go for the full name. Avi is basically he's online as a content creator, using and leveraging his dental experience and education to educate a lot of people about clear aligners. And so we'll get to that ultimately in this interview, but we want to get all the background stuff first. So thanks so much, Dr. Avi, for joining us. And let's just start off. I know I'll have questions that will basically pop up on the lower end, just to sort of highlight and where we are in the conversation. So we have about like 10 questions or so for you. So let's start off with the usual and tell us about yourself and your journey to become a dentist.
Yeah, thank you. I love the question feature. This is super cool. But yeah, so I was born in California, grew up in Jacksonville, Florida, and then went to undergrad there at UCF. And the journey of wanting to become a dentist, I think, started for me in like high school. I originally wanted to be an NBA player, believe it or not. I thought I could make it to the NBA because I was like one of the tallest kids in middle school, and I love sports. My parents kind of politely told me that probably wasn't going to happen, but I didn't believe them until high school, and that's where I stopped growing and I became one of the shorter kids in school. So I was like, okay, maybe my parents are onto something. So always good at math and science, loved interacting with people, helping people, and that's what kind of drew me to the health profession. And then when I shadowed my uncle, he's a dentist, he just kind of seeing the way I realized I think I was drawn to the lifestyle of dentists, where it was, I thought, 4 years of extra school after undergrad, you get to go out, you can, you're working for yourself, or you're working in a field where you kind of set your hours, you're not in a hospital. He seemed to be living a pretty good life. He didn't seem stressed. He seemed to be making good money. He was traveling. And so that really kind of drew me. I was drawn to the lifestyle where it's like, all right, work really hard, study, earn this degree, and then go practice as somebody who can have those three pillars, right? Time, money, and, a sense of purpose to help others. So I did that, graduated undergrad in 3 years because I was super focused on going to dental school. Got into NYU and graduated in 2018. And then, so that's the journey on how I became a dentist. There's definitely much more after that, but I don't know if that's the next question or not. I don't want to.
Oh, yeah, we'll get to, let me get to the next question, which is hopefully, let me get to a different question before the next question. Tell us more about your uncle. Was he a general dentist, or what was he doing in terms of practice?
General dentist, practice owner. He'd been practicing for 20 years at that point. So, he had a very robust patient base. And, looking back, I realize now that was what happens when you stick to something for a very, very long time, right? I saw, and this is where I went wrong in terms of like the whole comparison thing, where it's like, yeah, that is what it looks like to be a dentist after 20 years building something. I didn't know what his journey looked like right when he came out of school. He did tell me it was tough. But when you're younger and earlier in your journey, sometimes you can overlook kind of what it takes to get to what you see, which is the finished result, right?
Mm-hmm, mm-hmm. No, absolutely. So was he trained in the U.S. or did he train outside the U.S. before?
Yeah, so he was born actually in Africa, but he moved here in high school, went to college, also went to NYU Dental. But yeah, he was trained in dentistry here in the States.
Okay. The next question, which is usually on our regular docket, is how you decided which dental school you went to. So I was wondering if that had something to do with why you chose NYU.
It actually didn't. That just became like a coincidence. I actually wanted to go to NYU. A couple reasons. One, I was drawn to the city. I grew up in Florida, and I wanted to change. I wanted to go live in a city. And then at the time I had a girlfriend, she is now my wife. She was at NYU for undergrad. And so it was kind of like one of those like young, hopeless, romantic type things where it's like, oh, like, we'll go there. And it's not the best advice to like, choose a school based off of where your significant other is at that point in time. But, it was a pretty serious relationship for how I viewed it, at least. And at the end of the day, I also wanted to be in the city. So that's how I chose it. And then NYU is also, it's known for being a very good clinical school. Yes, it's expensive, but you do get good clinical experience. So that's what for me was kind of checked enough boxes to go for it.
Sure. Related to studies, you can go as expound on this as you will. A lot of our people who like to review us on Student Doctor Network are they're very impressed about things and want to know about your education. What surprised you most about going to dental school? What were some of the things that you had coming in preconception wise that sort of busted the various myths that existed that you had?
Yeah, so I think I thought that when you come out of dental school, you're going to know a lot. Like I thought you were going to know like a lot to the point where you can go off and be a successful dentist, right? Like I thought it was like you graduate, you know everything you need to know, you can go and like do everything. It's not the case. It's not the case. And that doesn't mean dental school doesn't teach you anything. Dental school does. But I kind of summarize it to where it's like dental school teaches you enough to not cause harm to patients. It's on you then after, where if you want to learn other procedures and do things like implants, veneers, clear aligners, like you have to go pay for that training outside of school. So that was a huge shock. And I realized this probably in my like third or fourth year of school, because I was like, wait, if we're still learning about fillings, I was like, when are we going to get to the good stuff? And then it was like, oh no, we're not learning that.
Well, it sort of leads to the next question, which obviously then you must have pursued a residency or go through the process of how you chose, what your next step was after you graduated.
Yeah, so I actually did not do a residency. And the reason being was because once I had that realization that, just like, you're not going to be taught everything in school. Then it made me go on the other side where I was like, okay, well, if I'm going to spend more time on something, I want to make sure I know exactly what I'm going to learn from it. So I would talk to upperclassmen who did residencies, and I talked to people who completed them. And it was good because everyone kind of said it helps you like hone in on some of your skills. So some of the basics like fillings, because you get to do more volume. At some residencies, they do allow you to do surgeries like implants and stuff. And even like some full mouth rehabs. But what I found out was those residencies, it was very rare. And even then it wasn't a guarantee. And so at that point, I kind of looked myself in the mirror. I was like, all right, what do I want out of the next year of my life? Do I want to go in this hospital setting? Also, that was another thing. I did not like the hospital setting. I was like, that was like one of the main reasons why I didn't want
GPRs, basically.
Yeah, I didn't want to do that. I know there's like AEGDs and stuff like that too, but at that point I was like, listen, I want some real world experience. Like I want to get out there. I want to find a mentor, because I asked people, like I asked dentists, like what's the best way to be successful? They're like, find a mentor, keep learning, keep working, keep practicing. I'm like, cool. So I was like, well, let me just go out. I can start getting the real world experience. Because even like treatment, like getting case acceptance and case presentation skills, you don't really learn that in residency, right? You're learning essentially the health profession version of sales, and you only do that if you're out practicing. So that's what I went for, and I'm glad I did, because I got a real dose of what kind of the real life of associateship looks like. But yeah, that's kind of how I determined it. I was like, I could do a residency, and I might have some better clinical skills, but my soft skills, my real life skills aren't going to grow. And I think I just valued the real life skills more, which is why I decided to opt straight to practice.
Sure. So did you stay in the New York City area, or did you go someplace else?
So New York State, I believe, is one of two states. I don't know the other state that requires you to do a GPR.
Okay, right.
It either requires you to do 1 year of GPR or 2 years of experience practicing in a separate state. So I was living in Manhattan, and then I actually got a job in Connecticut. So I was taking the train. So it was like an hour and 20-minute commute just by like via train and walking. But I was kind of willing to do it because I really like living in the city.
Mm-hmm. And where were you working when you got to Connecticut? So
At Stanford.
okay, all right. And is it the hospital? No, so you didn't do the hospital. So there was just a private practice you founded.
Yeah. So my last semester of dental school, I started just looking for job listings, making calls, connections, trying to find somebody looking to bring on, a new grad, and this office, luckily was, and I interviewed with them. And so I had the position like pretty much signed and locked in before I graduated. We were just waiting for my license and everything to come through.
And this was all your, did you have any help? But I don't know if there was career services on the NYU side or even the state dental or local dental societies in terms of finding the dentist, or was it just sort of a nice sort of networking opportunity? You just sort of cross paths with somebody.
It was a combination. It was like Indeed. No, there wasn't really stuff that the school gave us, which is a big gap. I think in the industry, I reverted to Indeed, believe it or not. So I looked on Indeed, and then the practice came up, and then one of my friends was like a rep for like a dental supplier company.
Mm-hmm.
And so he kind of knew some people. And then when I mentioned this name, I was like, oh, do you know anybody? And he's like, oh, I actually know the rep that manages that practice. They made the intro, and then I went. So yeah, it's like you have to network. You have to network to get a job. There is a resource that recently got created by Dr. Paul Goodman. It's called Dentist Job Connect. And it's essentially like Indeed for dentists. So owners and associates can kind of find each other on there, which it's a really cool platform.
Well, that's really cool. No, I appreciate it. I mean, I know that's been something that, we just sort of drop you into finding your own position if you don't use our alumni network or whatever else. So that's good that people are actually, being a little bit more resourceful about that.
Mm-hmm.
Tell me a little bit more. So obviously you didn't stay in Connecticut. Give us a little bit more of a sort of the journey to where you are now.
Yeah. So basically for me, I had off the bat, I had a lot of associateships. I had 8 in my first 2 years. And yeah, it's a pretty high number, but it's actually more common than you would think.
Mm-hmm.
And what it was is each situation was a little bit different, right? The first one, and I made a whole YouTube like video series reflection on this, but just keeping it high level. It was a lot of, I went in hopeful, willing to learn, willing to absorb information, and get better. And then something out of my control would happen to essentially cause for me to not be there anymore.
Mm-hmm.
So one of the offices, after I was there for about 4 or 5 months, they realized they weren't busy enough for 2 doctors. That's not necessarily their fault. Maybe my treatment planning skills weren't up to par, but it was multiple variables that could come into it. Another office, I was working there, and the owner was great. But after 3 months, he ended up selling the practice to 2 dentists. And then so they didn't need me anymore. There were some where there were some false promises, like, a dentist was like, yeah, come in, you can do whatever you want. And then, I was very clear about my intentions, right? Because that's what I learned is the more clarity you have at the interview, the better it is to see if it's going to be a fit. And not every job is a good fit.
Mm-hmm.
And then, after a couple months, he was like, hey, you really need to be seeing like kids, like this practice is heavily focused on kids. And I was like, well, you never mentioned that. And that's not, an area that I enjoy practicing on, kids. And so, it was stuff like that. But, I think my advice to younger dentists is always like, you have to know what you want before you take a job. You have to know what you want out of it. Right. And of course, we all want stability, but the reality is you cannot control things, 6 months, 1 year, 2 years, 3 years down the line. You can't. What you can control is what you are aiming to get out of that. Right. And so it's always in the beginning, it's learn as much as you can. Right. I'm a big proponent of it's okay to take less money in the beginning, in terms of like a daily guarantee, if the opportunity is going to reward you with some type of education. Right. And so once I had that mentality, I kind of looked at each associateship as an opportunity and as a chapter. So, my book just has more chapters to it in a shorter span. But I was able to learn, right? Because another takeaway that I had was I really thought that if you were a practice owner, you knew everything. You were on top of your game. You knew the ins and outs. You were the pinnacle. But after working at so many offices, I was like, wait a minute. Everybody's doing this dentistry thing differently. Some people are super organized. They have systems, very efficient, very great workplaces. And then other practices, the owner doesn't even know what's going on. Like there's no system. There was no onboarding. There's no nothing. So once I saw that, I was like, oh, okay, I get it. Everybody is trying their best and everybody is doing it differently. And that's okay. So it was another learning point.
No, that and that's something that I know I've told people is really, really crucial. Why we tell people shadow a ton of different practices before getting to dental school, because I'm sure you're going to be working a lot of different ones once you get out of dental school too.
That is true. And honestly, I didn't realize how important that was before, but I did shadow multiple different dentists. I wish I shadowed more. Like I wish I went into more offices that were just, in shopping plazas. Like, how are they doing it? Right? Like, don't just shadow the great, like the super popular ones. Like, go shadow the neighborhood one and get a sense of what it's like, because you may have to work at a place like that. And and I'll tell you this, there's more of those types of practices than there are the upper echelon ones. And when you come out of school, chances are you're not going to be at the upper echelon one from the beginning. It's going to be something that's more common. But this is just advice.
Absolutely. Nope, I understand. Let me do higher level questions in terms of what you most like about what you're doing, whether now, certainly now, and what isn't so nice in terms of things that you didn't like. You kind of told me that through the different associateships and the subsequent learning that you've had, you figured out what things you really want for yourself in your career, as a professional now. So expound a little bit more about what you like most and what maybe you didn't like as much.
Yeah, so I think two different segments here, right? The clinical practicing and then what I'm doing now online. So clinical practicing, what I really liked the most was, being able to interact with patients and have a variety of different things that we could do to address their problems. I thought that was like a great way to kind of mix things up. The thing that I liked the least was probably like the instability of the jobs, and just knowing that, I don't know how long this is going to last, but I'm still going to show up and try my best. I think that was one thing. Now my current career, which is online educator, content creator, I love just being able to keep it real and share perspective. I've always been the type of person. So I'm the oldest of three. I have a younger brother and younger sister. And growing up, I'd always be giving advice, unsolicited, as the big brother usually does. Mm-hmm. And then after a while, like my siblings would be like, "Hey, we don't care about that." Like, because they're neither one of them are in dental either. Because I literally was like to my brother, I'm like, dude, he's 7 years younger than me. I was like, if you want to go to dental school, I can tell you exactly how to get in. Like, I know exactly how to get in, like every step, everything. He's like, yeah. He's like, I don't like blood. So he's like, I don't want to go into health profession. I'm like, okay. So it's been nice. Like, I really like that I can share this stuff. I really like that I'm able to kind of express like my creativity. I didn't realize that I had such a big creative, component to how I operate, but it's really cool to make videos and do all that. And what I like or what I don't like the most is being emotionally connected to the content I put out there, right? Because my content is not for everybody. Some of my content can be polarizing depending on what your viewpoint is, right? Because when you get vulnerable and share your experiences about something, you are not speaking to the masses. You are just speaking and sharing your truth. And so people who don't agree with what I have to say can sometimes say mean things online. And I try my best not to take it personally, but it happens. So that would probably be like the thing that's the least enjoyable.
Sure. I know for most of us who've been involved with Student Doctor Network, we can very much relate.
Yeah.
Over the years and so forth. So I appreciate it. before we get more into the more, a little bit more on what you're doing now,
Yeah.
basically do what we need to do, which is let's put everyone on the same level and just give us an idea. You obviously much of your identity is really speaking to a lot of people, professionals included, about clear aligners. So let's make sure everyone knows what they are.
Yeah. So clear aligners, and great question, because even when I was in dental school and came out, I didn't actually know what clear aligners were, right? Everybody knows Invisalign, right? So basically what clear aligners are is clear aligners are the product, which is a procedure, and it's essentially clear trays, plastic trays that fit onto your teeth, and they apply pressure to move the teeth into an ideal position, right? So it's a form of orthodontics. Traditionally, you've got your metal bracket braces. Clear aligners is just another way to move teeth. Invisalign is basically the longest, it's like the biggest brand of clear aligners, right? And so now what people may start to hear is they may hear other brands like Clear Correct or Reveal or Sure Smile. Those are all done by the dentist, right? You have to go to their office to get this treatment done. There's like a whole nother side to this market, which is like your Smile Direct Club, your Bite, your all that stuff. And they cut the dentist out and they go straight to patients. Those are not the best. I'll just say that. Because you're bypassing the health professional, and it's basically a do it yourself for patients. Hey, like move your teeth yourself. So that is basically, just imagine, yeah. So clear aligners at the top, and then you've got all these different types of brands that have come off of that.
All right, so now let's go into how did you get interested in this area, and obviously educating others, including other providers, about these treatments.
Yeah, so for me, I got interested into it because after 2 years of practicing, I was starting to burn out. I was doing your foundational dental procedures, fillings, crowns, root canals, simple extraction, stuff like that. And I was just like, I really feel like I can do more. I want to do more. So I, invested in myself and I started learning. So took a course, learned how to do implants.
Mhm.
I rewatched all the videos online that Invisalign gives you because I was certified in school for aligners, and then I was like, okay, I'm gonna try this out. And then I actually had a mentor. I saw like a free webinar, and the Dr. Christina Blocker, she was my mentor, and she basically was like, yeah, if you ever have any questions, let me know. So I leaned on her. I started doing the procedure. Patients started agreeing to treatment. I started like 50 cases in 6 months. So now all of a sudden, it's like it kind of caught my attention because I'm like, whoa, like I'm doing this procedure that is, relatively does not take that much time to do. It's a high ticket procedure, so I was making more money, which was nice considering that I was always in and out of jobs. I was like, okay, this is fun. And then the third was just being a part of a patient transformation. Like it wasn't just let's fill a cavity. It was like, let's move your teeth and improve your oral health. Patients were flossing more. Patients were like coming in asking me questions because they noticed stuff. And I was like, whoa, this is a whole different dynamic. And I really liked that. And so I was like, okay, I'm going to do more of this. So I did more. But then my first reaction was like, people need to know about this. So I was working with 2 other dentists at the time. One of them, he had been practicing for 20 years, but he was open-minded, and I taught him how to do it.
Mm-hmm.
And I really enjoyed teaching him. And so at the time I was working for like a corporate dental office. And so I went to upper management and I was like, hey, what if I do like one less clinical day and I spend that day like teaching the other doctors in the group how to do this? Like it's an awesome thing. And then they saw the value in it, but they were like, hey, just focus on clinical. Like that seems like a big undertaking. And so I was kind of bummed out. And so my wife was like, why don't you just start consulting? Why don't you just start like just teaching other dentists in person, like coaching them up? And I was like, that sounds like a great idea. I was like, but what is consulting? Like, I don't even know what that is. So then she's got a finance background. So she helped me out. And, we got like the LLC and stuff set up. And then I just started working with dentists locally. And I loved it. So I had like a whole curriculum. and I was teaching docs how to do it. They were getting results. Yeah, and then that's when I was like, okay, how do I get the word out, right? How can I market the fact that I'm teaching people? And so I turned to something that was free because I had $500,000 of student debt. So I was like, I don't want to invest any money into this business or like more than I have already. Um, and yeah, I started posting on social media. I started making content and just educating people and trying to like get the word out, and that started to help me grow.
So that's awesome. That's a really great story. And having people really start thinking, hey, I could be a consultant too. Especially you've probably seen it happening in dentistry, and it happens probably more often than we really realize. What are some of the things that you're trying to sort of tell people, the realities of this technology? I mean, because it sounds absolutely great. And I admit, I've had my clear alignment done too,
Yeah.
way back when, and it is absolutely awesome. What are some of the things that you're telling potential providers? So, for like dentists, what are the downsides? What are some of the things that they need to pick up in order for them to really, fully, go full bore into, going into this technology?
Absolutely. So my biggest thing is, the first thing is you got to know where people are coming from, right? How much education do they have? How much they know? And the reality is in dental school, they don't really teach you much about ortho or this procedure at all. So they know little to nothing. And the less a dentist knows about something, this is human nature, by the way, but the less a dentist knows about something, the less they're going to do it and the less inclined they're going to be to like learn about it. Cause it's like, I don't know what that is. That's scary. I don't know. I'm just going to do this. And it's like, so I always say, look, with anything new, you got to start simple. Just start simple, like baby steps, right? With anything. And it's like, I always relate it to back in dental school. It's like, was the first procedure that you ever did like an extraction of like an impacted wisdom tooth? No, it was probably a cleaning or like a very simple filling or maybe a very simple extraction, right? And it's like, same thing, just like start with like simple cases when you get going or to get going, and then you can see that this is the best thing because general dentists have not been doing this procedure for so long. Like in every practice there's like 80% of patients actually have some type of misalignment, or they could use some type of straightening, right, to improve their oral health. um, there's dentists that I've taught where they don't do anything complex. I mean, I never did anything complex, and they just keep it simple. And you can just every single month you will have 10 patients, 12 patients that are just doing it. And then it's great because the more you talk about it, the more you can refer and give to the orthodontist. Because I'm a huge fan of orthodontists. I'm not here to take their business. I'm here to expand everybody's and help more people, right? But yeah, that's the thing. It starts simple. No. Easy. I mean, shameless plug. Like I have so many videos on YouTube and Instagram where I'm like just teaching the basics for free, and I encourage people to just watch it.
Mm-hmm. Oh, no, and I definitely appreciate it. So basically, ultimately, once they get acclimated to the simple things, obviously, then they can just build up to more complex alignment challenges and so forth, or at least refer.
If they want, yeah. And that's the thing is there's like, there's a lot of other people out there that are teaching the higher level stuff for this treatment. And so if their passion grows with it and they're like, oh, I want to do as much of this as I can, great. Continue to learn from all these other providers out there that are educating on it.
I'm gonna guess you probably get asked a lot for like the local the conventions, like the state dental association meetings and so forth. I want to investigate the interesting question that I know comes up with this space. Is of course there are the corporate entities. We talked about the few brands that are out there. How have you navigated those relationships with those corporate entities, or have they come and talked to you or reached out to you, or I want to get a sense of how you do that.
Yeah, you're talking about like the brands like Invisalign and stuff like that?
Yeah, yeah. Mm-hmm.
Yeah, so basically, my program that I have, it's like brand agnostic. So there's no affiliation with anybody. I actually had one of the brands, they actually wanted me to make them like a custom program. Um, and so I entertained it and we kind of did like a pilot. But what I found is that I don't know if these corporations are aware of the gap, right? And the gap being this like entry level education. And so, I navigated it by like that exact one. I think, some feedback would be whenever you deal with anything corporate, things can take a long time, like very long. So, and there's multiple people that are involved in terms of making decisions and whatnot, but I guess I led with like, curiosity, and just tried to always be positive about it. But what I've found is like I don't know if going this route of working with the corporations is the most effective use of my time right now. I'm always open to conversations, and kind of seeing what can happen. But after that experience, it was a great learning experience. But I think it kind of also further pushed the point to where I was like, okay, I need to just continue to focus on serving the doctors in my program. And then, also just I looked at it like there's still a lot more work of marketing left to do before jumping in with these corporate entities.
So we're not talking about like all of a sudden this whole wave of general dentists are going to adopt. You're basically, definitely not adopting clear aligners to be integrated. It definitely will take a lot of time, and
it's gonna take time. But the only way you do it is through marketing, right? Because you've got all these general dentists who are like right here, and then you've got this wall, and the wall is the fear, right? And on the other side, everyone's afraid to like burst through, and it all comes down to education. So that's why I was like, well, to break this wall down as effectively as possible for everybody, why don't I just give away as much free education as possible? And then people will either learn from me or they will find another resource to learn from. But if they do that, they're learning and they're able to get past that wall. So everybody wins. But, it takes a lot of effort and time to be able to break that down. But that's why, I transitioned from doing this on the side to full time, because I'm like, there's a lot of work to do, and I'm super passionate about it. So,
well, yes, hats off to you for again. We definitely can we recognize that on our side of the house too. You mentioned obviously there are obviously these Smile Direct clubs, and a lot of these, as we mentioned, sort of the do-it-yourself, and you sort of leave out the dentist as the middle person, or at least the person to kind of oversee the just making sure that health-wise you're actually doing the right thing.
Yeah.
Are there instances where people are coming into, say, general dentist office having done this and have like gotten their mouths, I won't say screwed up. I don't think they would totally screw them up, but what are some of the circumstances that general dentists may have with people who get that wrong? So
100% it happens. I mean, when I was practicing, I was seeing it. It wasn't super common, but there were definitely patients where they came in, they're like, hey, I did Smile Direct Club or one of the do-it-yourselfs. And it was, some of them I could help and I could actually fix it myself. But others I was like, this is over my head. Like, you need to go see the orthodontist. And I've also had patients where I've offered before they did anything to do their treatment. And then they would be like, oh, I'm just going to go with one of the online ones because it's cheaper. And then I'm just like, okay, well, if you have problems, let me know and I'll send you to the orthodontist. And it ends up costing the patients more, right? And again, can some cases be done by these online things? Maybe. But it's just like it's risky, right? You're taking a risk and you're signing away a lot of the liability, and it's just some people are willing to take that risk with their own health, and other people aren't. So
are there some technological changes coming up? I mean, I don't know about AI or anything else like that, but I'm sure there's a lot of, with increased computer power and so forth, there's a lot that's being done to make to have some clear technology innovations in this space. What insights do you have about that?
Yeah, so it's actually pretty cool. So there's they're leveraging almost like a smile design soft, like an overlay. So it's cool. Invisalign has this right now, and it's called Smile Architect. So you can literally take a scan, like you do the digital scan of their mouth, and you can take photos, and then you upload it into their software. And you can, like, if let's say somebody wants a full smile makeover, you can plan to move the teeth with aligners, so that way it sets up your case to do crowns or veneers, and to really optimize the result and minimize the amount of like tooth structure that you would have to remove to be able to get those results. So it's pretty sweet. And even right now, like they've got the smile simulator. I think most brands have it now. You can scan the patient's mouth. You can take a picture, you put it up, but it takes like a minute or two, and all of a sudden it's their face with their like what their teeth would look like. It's so cool. It's so cool.
That I know we're all looking forward to all that. I'm glad you're near the edge of the sword to see all of this happen, and I'm sure this is something everyone wants to see ultimately.
Oh yeah, it modernizes dentistry. It brings dentistry to 2023, right? Like we've all got like no one's looking at black stuff in black and white. Like everyone's got iPhones, everyone's got 4K, 8K. It's like in the health profession, it's like why can't I mean my wife and I were pregnant and I'm super excited to go in for like the anatomy scan, because now it's like apparently you can see like what your baby looks like. Like before it was just ultrasounds, and now it's like, we'll show you like a 3D scan of your kid. I'm like, what?
It's been there, but it just the computing power is such, it's just incredible nowadays. So let me take a little bit further out. What are some of the real challenges you think are facing the overall field of dentistry?
So I think the real challenge is it's mindset, right? It's mindset. It's when people are thinking that just because something was done a certain way, that's the way it needs to be done forever. And I think if that mindset, and that is prevalent, I know in the world and people, but in dentistry in particular, there are too many people who think like that. And you can talk to any sales rep in the dental field, and they will tell you dentists are the hardest people to sell to. And it's because it's this, I've done it this way for so long. Why would I change now? And it's like, well, because this is more efficient and this is it's a better experience. It's, the laundry list of the benefits of innovation, right? That's what innovation does, is it makes things better, makes them more efficient, effective, and accurate. And I think that's the biggest challenge right now, because you have dentists that are practicing today that don't have a scanner. And in my opinion, that's wild. And it's not because they don't know how to use it or anything like that. It's not accessible. Like it is. It's just a lot of dentists are still stuck, and they're like, well, for the last 15, 20 years, I've taken molds and impressions, and I've made, I have good results, and I've helped my patients, and things are good. And it's like, yeah, well, patients don't want like gooey stuff stuck in their mouth. Like they've put up with it because they have to, but like if you ask a patient like, hey, do you want me to put this slime in your mouth for 2.5 minutes and you might be gagging? Or is it cool if we just take a bunch of pictures for like 2 minutes?
Yeah.
And it's like with a camera, and they're like, oh yeah, let's just do the picture. So it's the mindset. And it's like, if you stop thinking like, oh, just because it's always been at whatever it is, just because anything's been done a certain way is the way it needs to be done in the future. If you break that, it solves so many problems, because not even from the technology standpoint, even from the way you treat people, right? A lot of dentists who are owners, they were associates at one point. And this is like, I call it the toxic cycle of dentistry, where you came out of school, you were willing to learn, you had big dreams, big goals, you work for an owner. Some of them, not all of them, but some of them, they don't really treat you the way that you would expect from like a mentor. And then it's a traumatic experience. And then now you leave and you're like, well, if this is how I'm going to get treated, I'm just going to do it myself. And then what happens is then they become the owner. And then fast forward 5-10 years, now an associate comes to their practice, and then they're just like, well, this is how I was treated, so I'm going to treat this person like that too. And it's just like, let's just stop doing that. Why can't we be more uplifting, more empowering, more supportive? And so that is like my like long-term goal of something to try to solve in the field. But it's not like, one, I know I can't do it alone, and I know it's going to take time. So
it's also really challenging and difficult because part of I think part of the resistance to change, I know there's always some financial investment that you've got to do it. I mean, even reworking your entire clinic in terms of, your clinic spaces, remodeling them, probably that takes a fair amount of resistance, I'm sure. So even purchasing something, which means you may have to remodel this piece of your office and so forth down the line. I think it's just the fear of, do I actually have enough money? Can I really?
That's true.
And I'm sure it has a lot to do with it too.
I think certain like technological things like, CT scanners, stuff like that. Yeah, you need a whole room for it. But dude, like a scanner, I mean, you can get it now where it sits on the table and you plug it into like a little laptop. Like they've made it. It's funny because the dentist resistance to it, I think, has forced these companies to innovate even further. Right? It's like, oh, here's a scanner that you can roll in. It's really nice. They're like, no, it's too big. So they made a smaller one. It's like, no, it's too heavy. They made a lighter one. It's like, no, it's this. And so it's like kind of actually funny when you think about it.
Yeah.
But yes, it is an investment. But like with anything in any field, it's just like you have to, kind of invest in the upgrade. Like, why do we buy new iPhones every couple of years?
Right.
Right. It's something. It's to get a faster, better, longer lasting thing. And it's the same thing in healthcare, I think, too.
Yeah. Heaven forbid that they're still running on, I don't know what the old Windows 94 or whatever number operating system is for their chart management or something.
Yeah, it's cost of doing business, right?
Yeah. Absolutely. The last prepared question obviously is one, because we deal with a lot of people who are aspiring health professionals. And so a lot of pre-dental students, want to figure out, why am I doing this? What should I be looking for? So I don't know if you're currently mentoring other current dental students or any pre-dental students, but what general advice have you given to anyone who might be thinking about pursuing dentistry? Obviously, your brother who's afraid of blood, not one of those people, but other people that you may have mentored or want to mentor. What is your general advice?
Yeah, great question. I love this. I think you have to get very clear on what you want out of the profession, right? Like, what is it that you want? And once you get clear on what you want out of it, I challenge you to do the exercise of thinking, is there another profession that I can do that could check those boxes, right? For example, I have no regrets for going into dentistry, but I think if somebody challenged me to say, hey, if you want to have a life where you've got time, money, and you're able to help people, I challenge you to see if there are other career paths that you can take, just to kind of brainstorm. Because now, instead of just like, because for me it was just med school, dental school, dental school. Like, and that wasn't the right exercise. I think it should have been, right? Because like there's a whole nother field of just being an entrepreneur, right? It's like, because some people, it's like, oh, I want to be a dentist because I want to be a business owner and I want to be my own boss and I want to help people. There's other ways you can do that, right? And I think, and the reason why I stress this question is because the cost to become a dentist is going up every single year. I want to say it's probably the most expensive healthcare profession from an investment standpoint. And the reality is on the other side, like we talked about, this is bringing the conversation full circle. You're not coming out making $500,000. Like, you're not coming out making 200,000. Like, you're probably coming out, just in like the low hundreds, low to mid hundreds, right? And it's like, you can get to a higher income potential, but it's going to require you to invest more money to get more skills, to do more things, to be able to help more people. And, that's why I think it's like, it's not as like, back in the day, I think it was easier because the financial burden wasn't as hard. It wasn't as big. So it's like, yeah, you didn't really have to do so much work. And I think, and again, and what I think that exercise does is it forces you to actually think, right? You don't need to necessarily know exactly what your life is going to look like, because I know that's a tall task when you're younger, but you need to know kind of what you want, like, out of it. And then what I think that does is it helps set the expectation, and then you can kind of work backwards.
Mm-hmm. and I think a lot of students are very interested in dentistry, but I agree with you. The debt is, I know you came from NYU. The debt's really high coming out of NYU and a lot of other schools. I mean, many of them are starting to cross that $500,000, coming out of school threshold now. So, I mean, any thoughts in terms of like how did you help manage, obviously your own financial situation within now, congratulations with your new one coming along the way, but managing your finances and keeping your head straight while you're even going through all of this job insecurity of hopping from associate to associate. What are some of the things that you remember doing or want to keep
Yeah.
in mind as people are going through that process, more junior than you in these years? So
Yeah, totally. So I think, I'm fortunate. I am not as fortunate to have like as someone who has parents who pay for it and they have no debt. But I'm also not, in a situation where I was on my own. So, I actually had some financial support from my wife. When I was going through dental school, we were dating and then we got engaged right after, and then we got married. And so, I was able to get, when I was working out of dental school, her income was we were kind of relying on that to be the stable income. And then, whatever I was getting, it would go towards the loans and some savings where we could. But to manage the debt in the beginning, it was the income driven repayment plan, right? The government loan. So that was great because what it does is it, like, even when I was out of a job for, some time, I would call them and I'd be like, hey, I don't have a job right now. And then they would, basically, I wouldn't have to have a monthly payment. Interest was still accruing, but I wasn't going to be penalized for not making my payments for 3 months because I needed that $3,000 to pay rent or to do something else. So I think early on, staying on that government plan, like, don't be so quick to refinance until, like, my advice, again, not a financial expert, but
right.
I just think like a general strategy is like, lean on that government. And I know it's it's a high percentage of interest, but like, lean on the ability for that, like that flexibility and like kind of the forgiveness aspect of it, until you get really stable. And then once you get stable, that's when I would recommend you refinance it.
Yeah.
Because in the beginning, it's just like a couple $1,000s is a lot of money when you're coming out of dental school relative to everything else 20 years down the line. It's in our profession and just kind of the amount that we do earn, it's actually not that much in 20 years. So it's like, don't try to solve that problem today. Like, you can solve it then. Like, just make sure you're taking care of yourself and able to live today.
So one question before leaving. Is your uncle one of your clients in your consultancy in terms of doing clear aligners?
Funny question. He's not actually. He is, because he's part of like an older generation. And I mean, he's super supportive of what I'm doing. He actually already like knows how to do this stuff. So he was already doing it. He was like an early adopter. As a general dentist, like, he was one of those that does every procedure. He does implants, extractions, metal braces, and then he was doing aligners. So yeah, no, he's not one of my consultants or one of my students in my online program. But yeah.
Just wondering, because it's kind of like, it sort of dawned on me. It's like, maybe, I don't know. So,
No, yeah, he's honestly, he is like at that point in his career where it's like the tail end. Like, he's chilling.
that's cool. For current dental students, any advice for current dental students, just so that they could just sort of like keep pushing forward and keep going?
Yeah, I think, look, like, my biggest thing is like, don't overstress in your first 2 years when it's all academics and lab work. Don't overstress about the grades, right? Study for these exams, try to do your best, but you need to start implementing a sense of balance in your life. And I say that because when I was in dental school, it was very much like work hard, play hard. But like, made sure that, like, a lot of people are like, oh, dental school sucked. Dental school was like, it was 4 years, but I mean, it was pretty like, yeah, it was stressful, but I thought I had fun. Like, I found the time to have fun. And that's the thing, is you can have it. So you got to know it's a marathon, right? It's not a sprint. So, don't be so hard on yourself then. Don't compare yourself to classmates. It does not matter what, the other people are doing. I came to the realization very quickly, like, hey, I'm a middle of the pack guy when it comes to academics in dental school. Because you got to remember, everybody in dental school is very smart, right? So like you may have been top student, high school, undergrad. You're now in a group of other top students. So like it's okay if you're not all the way at the top. Like just cool it. Do what do what you need to do to move forward. Because honestly, the real thing comes down to clinic, right? You got to make sure that you still got enough gas in the tank for clinic. If you burn out after your first 2 years of academics and you now don't care about what you're doing and you suffer clinically, well, you're behind the 8 ball for the rest of your career. So my whole thing is like, have a good pace. And then once you're in clinic, that's when you go hard. Do as many procedures as you can, shadow as many upperclassmen as you can, be in the clinic as much as you can, because the more you do then, the better, like you're going to act. That's when you come out on top, right? That's when you come out more prepared, because you get out what you put in dental school, period. You put in a little bit of work, you're going to get a little bit out of it. You put in a lot of work, you grind, you will get so much more for your dollar and for your time.
I was going to ask how that was sort of measured during your clinical years in terms of, because every school will do it a little bit differently. I don't know how NYU does it in terms of, giving you credit for doing certain procedures and, how you were assessed competency wise for those.
So we had a certain number of each procedure we had to do. And then we also had, then for each procedure that you do, you get a certain number of credits. So by the end of the year, you had to have a certain number of credits. So it was like certain number of procedures in each category. And then also overall, you needed to do a certain number of credits. And then, you would basically have to do like 1 or 2 competencies for each procedure. And then a professor or faculty member would basically grade you on whether or not it was acceptable.
Yeah. And then obviously, mostly you're doing a lot of work in the comp clinic and comprehensive care clinic. And I don't know, were you able to do, or any of your peers able to do, basically, we'll spend a day over at Perio or whatever else like that. Were they able to do stuff in the specialty too?
So we had some rotations. So NYU does have like all the specialties. So we were able to do rotations. So, and I think, we would be, we went into Perio. But that's the thing, is like some of them, you're not really doing anything. And they're like, we were just watching the residents. So that was a bummer. But it was cool because I actually got we got to have like a externship. So I actually got to go to a hospital where oral surgeon residents were for a week. And just, I got to watch them. I had to go to the morning meetings. I got to even do some procedures with them. So it was pretty sweet. But yeah, you do. And that's the thing. Each school is different. But NYU, they did let us kind of go in. Like there was, when we would be in the pediatrics rotation, we'd be in the peds clinic working on kids. So it was good.
And patient management, I mean, who were you responsible, or what was the support structure for making sure you always had a decent schedule, or at least the patients would come in on when they were supposed to?
So the schedule you built, you kind of had to build on your own. So that was one thing. When you go down to the new patient, like patient, I forget what they call it, but it's like wherever new patients go, you had an opportunity to go down there and get patients. But it was a lot of like you had to kind of do it. Like there was a little bit of they would, your treatment coordinator would kind of fill it where they could, but it came down to you. So actually what I started doing is I got coupon, like there was something where you could get like free exam coupons or whatever.
Okay.
And so I'd actually jumped onto the Facebook group for NYU as a whole, like in the alumni. And I was like, hey, if you need a free cleaning and exam, come on in. And so I actually like got leads from that. So that was like, that's looking back, like that's when the entrepreneur side of Avi was coming out. I was getting creative and finding ways to get people in.
I tell people in my day is like, you got to realize you're going to learn your own business skills, whether you like it or not, if you want your patients. So I have a lot of people who pin, free, those same type of coupons, but they go to all the Starbucks and all the coffee shops and just pin them on their community board and say, and that's one of the ways that they were able to get patients in.
It's for, and that's the thing is, once you put on that hat, like, you realize like the next person is not doing this. Like,
yes.
You can always do more. You can always market more. You can always, where there's a will, there's a way. That whole saying, like, it's 100% true.
Absolutely. I'm going to go ahead and cut it off here. But I really thank thank you, Dr. Avi, for talking with us through this recorded interview with the Student Doctor Network and a lot of our students who are interested in dental and so forth. And just briefly, just tell us what are the handles where anyone can probably see some of your videos if they really want to learn more about clear aligners.
Yeah, so Instagram and YouTube are the two biggest platforms that I post on consistently. On Instagram, it is dr.avi, and doctor spelled out. And then same thing on YouTube, it's just Dr. Avi with doctor spelled out. Yeah, those are the two. And like, I have a whole playlist on YouTube where it's like called the Clear Aligner series. So if you want to learn, you can learn that. I also do a lot of videos on like advice, insight. So we touched on a lot of the topics here, but if any of those topics interested you, I'm pretty positive I have like an entire YouTube video where I dive deeper. But yeah.
Sounds great. One other last bit, I guess. How did you get to Austin?
So we actually we got married out here, just west. It's called Horseshoe Bay. And so when we came to visit the site, my wife and I, we kind of got to check out the city, and we're like, "Whoa, this is a pretty cool place." And we're like, maybe we'll move here one day. And then you fast forward 2 years later, during the pandemic, we wanted to get out of the Northeast, and then also in Texas, it's in Austin especially, growing city, a lot of dental practice opportunities and whatnot, and yeah, we eventually made the decision to come because my wife works remote, and so we made the move about 3 years ago.
Well, I'm glad it's working out, and good luck to you and your growing family. Thank you so much for talking with us, and hopefully, hopefully business will be good.
Yes, thank you so much, Emil. I really appreciate it.
All right, thanks. I'm going to end the recording. Thanks so much.